Hi everyone, I'm Maimah and you're watching Breathe TV. I am your host. Today we have some special guests with us, Dr. Lori Wilson, a cancer oncologist and a surgeon, and Temi, Omaghomi, a breast cancer advocate with Tiger Lily and an amazing survivor, thriver, and warrior. So Temi, we connected, I think it was early in the springtime when COVID had just started, and you were just kind of navigating the early part of your journey, and you weren't really talking about your breast cancer, and you were still in that fear stage. I love seeing you here this morning, glowing and just so, ready to share and so empowered. So tell those who are watching about your journey, where it started, where you're from, and where you are today.
So I was diagnosed with breast cancer on the 8th of June, 2020. It was a shock to me because I actually didn't have any symptoms or anything. I just went in for a breast reduction because I was having like a lot of back pain and neck pain. I'm really nosy. I like to ask questions. So I asked my plastic surgeon what he does with the tissue that he's going to remove. And he said, we could throw it away or we could send it to pathology. It depends on the patient. And I elected to have him send it to pathology. Yeah, so that's how I found out I had breast cancer. When the results came back, it came back with DCIS, which is ductal carcinoma in situ. When I was diagnosed, I was really shocked because I had no symptoms. It came as a shock to me. I went on Google and I started to look for, breast cancer patients, and all I saw was older white women. I didn't see anyone who looked like me. And then I decided to go on Instagram and I did various searches and I started to come across young Black women. I actually connected with this lady called Patricia. She's also in Tiger Lily. And it was great because she introduced me to Tiger Lily. And I remember the first Friday after I was diagnosed, I joined Tiger Lily's Pajama Glam, and that's where I met Maimah, and it was just so great to, talk and just have a place where I felt like I could be heard.
Temi, how old were you when you were diagnosed?
I was diagnosed 3 weeks before I turned 23, so I was 22.
So for those who are watching, I want you to think about the number that she just said, 22 years old. We think of breast cancer as being an older woman's disease, but people get it in their 20s and 30s as well. Temi, thanks for being your own best advocate and being proactive, and thank God for that. You're still here today. As you were talking, I started getting emotional. I remember, it was like COVID was getting into really big COVID, and we got on that call, and you didn't want to get on it first. You didn't want to show your face, and you were nervous, and we were like, get on camera and just talk. And the whole goal of this series of Tiger Lily's work of breathing is to give women a safe space to go to find people who look like them, who they can relate to. And as a Black woman, as a young Black woman, sometimes you don't find people that look like you in the space and you don't feel comfortable to share your story. And so I'm so emotional just hearing that you were able to find us and have that safe haven, which is what we create. I didn't have that when I was diagnosed. I was the only woman that looked like me that was my age. I was a brown and Black woman, and it was really lonely, and the goal is to give people that space, and now that's there for people like yourself. So Temi, you're from Africa, as I am as well. My mother was my biggest advocate. She taught me the importance of breast exams at 13 years old, and she was my biggest supporter. However, when I was beginning to come out with my story and talk about it publicly, she wasn't too happy about it, because in our culture, it's kind of something that you keep to yourself. It's a woman's problem. It's a hush-hush family issue. How did your family handle your, coming out about your diagnosis, and why was that important to you to share with others?
That's a really good question. So yes, I am Nigerian. I was raised in Nigeria. I only just moved to the US about 6 years ago. So yes, I'm Nigerian. And just coming from that culture, like you said, a lot of things are just keep it to yourself. This is something bad that's happening. You don't have to tell the world, just keep it a secret. So already having that upbringing, I kind of struggled at first. I was really I guess, shy or scared, to open up about it. And I didn't want anyone to know. And it was just me and my mom and my little brother. I didn't want to tell anyone. Coming to the first pajama glam that I had with Tiger Lily, that really helped me. you can't give this situation power over you and, just let it weigh you down and you keep it a secret and you don't tell anyone. So just being able to share in that space inspired me to also share openly. So yeah, I decided that I was going to share, but at my own time. So I started to share with, my closest friends, my cousins, and stuff like that. And then in a few months, I kind of opened up publicly about it. And it was hard because that wasn't something I was used to. But I would say once I opened up about it, it was like a weight lifted off my shoulders. For the most part, everyone reacted in a good way, supportive and all of that. I still had one or two, relatives who were like, this isn't something you should tell people. And I just kindly said, this is my journey, this is my story, and me keeping this to myself does no good for anyone else. Because the reason why I have all this, bravery and strength and courage that I have now in this journey is because of the women who came before me, who shared their stories.
For those watching, for many of us as survivors, having that sisterhood is our lifeline. And so when you find that sisterhood of breast cancer survivors, warriors, doctors who look like you, it gives you a whole different outlook on what's possible to navigate your breast cancer journey. Dr. Wilson, you're a female, you're a Black woman, and you are also a breast cancer survivor living with MBC. So I'd love to learn more about your story and what you found as you shared your journey with many people around the world.
When I think about my diagnosis, I was originally diagnosed in 2013. It was altering for me, life altering. I had a 1.5-year-old at that time. I was just getting back to work. I was figuring out how do I juggle, being at work mom, being an at-home mom, and, all of the things that go along with that. I was doing what I was told by my pediatrician and my obstetrician saying, you need to breastfeed. You should breastfeed for at least a year. You need to make sure that, you're doing all the things to build the immunity for your baby. And I felt so important. That was so important. They tell you not to gain more than, at that time, 30 pounds. I did that. I exercised, I ate well, I did my folic acid. But one of the things I found when I stopped breastfeeding is that one of my breasts didn't go down. And for me, knowing what I know, being a cancer surgeon, I knew that that was something that was ominous. What I didn't know was that on the side that I had the large breast was that there was cancer there, but I expected that. What I didn't expect was to have a cancer also in the other breast on the other side, and that they were two different types of cancer. One of the things that I think is important for doctors to know, and things that I learned, is that oftentimes we have to be thoughtful of the statistics. Most women are diagnosed in their late 50s if they're Black women, early 60s if they're white women. And so their agendas for care may be very different than someone with a 1.5-year-old. So I initially went through chemotherapy, I went through radiation, I went through double mastectomy, I went through a reconstruction that failed, and I lost my reconstruction due to a bad infection. And so I'm one of the unreconstructed women out there that have decided with my husband that we're not going to do a reconstruction. And that actually is fine with me. And so, the goals were different for me. Just coming back to making sure that your team has your back, that they know exactly what is important for you. For me, it was having aggressive treatment. I honestly didn't want to wait. I knew that there's oftentimes short windows that you have to be able to take advantage of before you lose those windows. I was kind of at that place when I was diagnosed with my MBC. What I found was that every month my disease was kind of chipping away, moving on slowly. But I knew that if I did not make an active decision that I would potentially lose the window for something that could be miraculous for me. And I had to also be open to hearing about what was potentially miraculous for me. And I said, you know, I am in agreement with aggressive treatment, but I'm also in agreement with a stage 3 trial, which means a clinical trial that has been tested and proven to be at least equal to what I was getting, or potentially even better. It is important to know that you absolutely have the opportunities to be a part of these studies that can change your life. For me, I decided that I was going to do immunotherapy. And what I found out was that when I did that, my disease actually decreased by 90+%. It went away in my organs and just a small amount of rebuilding in my bones. And it's been great. I live my life very intentionally now. Life is not a given. And so everything I choose in my life, it is hopefully to be better, to make our family stronger, to be a better clinician, to be a better mom, to have a better life, to have the life that works for me. And one of those things is growing my family. Because I had chemotherapy and because of this diagnosis, I was not able to have any additional children, at least biologically. But for me, I've been able to have foster children in my life. And this week I've gone from 1 child to 3 children.
Everything you said was just so beautiful. I'm like, I'm really at a loss for words, but I am, because of who you are as a human being. You've always shown up, spoken your truth, spoken your pain, your hopes, your vulnerability. You're now fostering 2 children. You're the epitome of what we look for in Black leaders and human beings, you know, who take their stories and transform them into catalysts.
Thank you so much.
You know, you're the kind of doctor that somebody hopes they get, you know, when they get the diagnosis, because, you know, it's scary. And, you know, people think that we're all bosses and we're fearless advocates. But when the lights go down, you're in your bed at nighttime, you worry about headache or backache or pain, or you lose a friend, and it never goes away. But you get up in the morning and you put on your makeup and you smile and you go forward anyway, because God has called us to serve, and that's what we do. Temi, you're looking at Dr. Wilson. You know, what would you tell a young woman looking for a doctor after hearing all this?
It's crazy that you asked that question, because the whole time Dr. Wilson was speaking, all I was thinking is, oh my goodness, why isn't she my doctor? Why wasn't I in her state? You're an amazing doctor. Doctors like Dr. Wilson are the kind of doctors that you want to have. Like, no one wants to have cancer, but if you have to have cancer and go through it, you know, your doctor should be somebody who is compassionate, somebody who is genuine. And just from hearing her speak and interacting with her, you can tell that she's genuine, she's compassionate, and she knows her stuff. So that is the kind of doctor that I look for. That is what I look for while I was going through doctors. I needed someone who listened to me, who made me feel heard and seen, and someone who knew what they were talking about, but still was able to explain things to me in a manner that made me feel more comfortable.
A lot of Black patients say they don't get told about certain things, about genetic testing or clinical trials, and there's so many barriers to care as a Black woman, which Dr. Wilson and I have discussed many times before. Dr. Wilson, can you share a bit about some of the things you've learned that are barriers to care that your Black patients have shared with you? And how do you help them, because you do help them overcome those barriers to care to ensure they have the right options, the right tests, and a healthy and happy and longer lifespan?
Some of the things that I hear from my patients is that I'm not heard, that it doesn't feel like we're on the same page. It doesn't feel as though they have my best interest at heart. If that's the feeling, that shouldn't be your feeling. You should feel as though the person that walks in that door is focused on you and you alone at that time, that they bring a sense of care, also a sense of understanding what specifically drives your disease, things that you should know. You should know what your stage is when you leave the office. You should know the different team members that are going to be part of your team. You should be able to ask, who will be my team members, my medical oncologist, my radiation oncologist, my genetic counselor, my patient navigator? What opportunities do you have for me in your practice? Because it shouldn't be, Maimah knows me so well that this is a soapbox issue for me. So an issue that is really concerning to me, that patients have to chip away and ask for these things. These should be laid out to you. These are not things that you should have to bring in your mind. Will they ask me about patient navigation? Will they make sure that I have a medical oncologist that knows my diagnosis and is the next part of my team? Honestly, I have a tremendous amount of information about other specialties. I absolutely read and I'm on top of my game, but there's so much information about other specialties that it is my job on the team to be the expert in surgery, that I should know everything that is coming down the pike, everything that could be helpful for my patients, and know that that information that I give them is the best possible information. And every team member should do that for you. So sometimes I hear from my patients, why do I need to see this person? Because good decisions are made with good information. And me, as well-meaning as I may be, may not know every little detail that is particularly important for you to know so that you can make the best decision for you. And so having these other specialists in your corner making your decisions is important. There are guidelines that are specific to patient care. So you should at least get the gold standard. You want the platinum, but you should at least get the gold standard. You should make sure that your team is coming and together on what we call a tumor board or a breast conference. And that means every member of the team that is part of your care comes together to talk specifically about all the details of your cancer, and then comes up with a plan that is specific to you. We've gotten to a point that it's no longer cookie cutter. It is specific decisions that are made specifically because of the molecular and the genetics and the histologic, all of these fancy terms, which are specific to what your cancer is and what you walk into the door with.
Yeah, wow, you just schooled all of us. You just gave us a whole sermon, which is amazing. I love it. For those who are watching, Dr. Wilson just gave us a whole sermon about the importance of physicians being their patient's best advocate and having the patient be educated about what to know, what to ask for, getting second opinions. And when you do that, the patient becomes more empowered. They have that faith in their healthcare team, and it can and does change patients' outcomes. But for Black women who tend to not have these options oftentimes, not have providers who understand them, who have doctors who may have a bias against a brown or a Black woman, or doesn't explain to them the importance of trials or genetics, they don't have the access to those kinds of educational tools and treatments and they have worse outcomes. My lump was found at 31, took me over 6 months to get diagnosed. I got a mammogram, came back clean, which was false negative. I had to push for a biopsy for 6 months before getting diagnosed. If I hadn't done that, I would be dead today. And so I sat back and I thought, if I don't do this thing, if I wait until I'm better, people are going to die. And there must be other me's out there asking, am I the only one? And I knew there are people like yourself, and Dr. Wilson we found you as well. Advocacy changed my life. How has it changed your life and empowered you to do what you're seeing more of amongst, brown and Black women who are advocates themselves?
This whole experience, I feel like that's one of the biggest things I've taken from this journey is how to advocate for myself. So before this, I thought I knew how to do that, but going through this just showed me that, okay, like, you can do a better job for advocating for yourself. And this has translated also into other parts of my life, not just my health, but just in every aspect of my life, my career, my relationships, I just speak up for myself. Like if I have a question, I ask the question. If I'm not comfortable with something, I don't, just, okay, I'll just try and manage. No, like I want to know what I'm getting into. I need to speak up for myself because nobody's gonna nobody's gonna do that for you if you don't do it for yourself. So this gave me the bravery and the confidence that I needed to always speak up. Everybody's opinion and everybody's, mindset is important. So at first, I know some people, they're like, oh, the doctor knows everything. They're trained for this. They went to school for this. So let me just be quiet. But, the doctor is really intelligent, yes, but you live in your body every single day of your life and you know your body. So just, it has really helped me to speak up for myself. And also, now my friends know me. Like after going through this, I'm like, I hope you guys are checking your breast every month. I can show you how to do it. We can get on FaceTime and I'll show you. Like I've just become that person who I want everybody to be informed of their body and themselves. And just because, you hear, I know before I got diagnosed, I always heard about breast cancer, but I never thought it would happen to me. I was just in my mind invincible. When you're so young like that, you sometimes think you're invincible, but this process really just showed me that anything could happen. So you need to be prepared. And yeah, so advocacy has been really helpful to me. I use it every day of my life at work, when I'm talking to my friends and stuff like that. And yeah, so advocacy is really, really important. That's one of the biggest takeaways from this whole journey for me.
So Temi, as an advocate, there are things you learned about that you didn't know before, like the importance of your genes and clinical trials. I had to ask about genetic testing when I was diagnosed. Nobody offered it to me. I had to ask about fertility options, and I was told, don't bother. No one ever offered me a clinical trial in the 14 years of my breast cancer journey. And I thought it was shocking that, even as an educated woman, there are things that you know about breast cancer, but there are things that you don't know. And it's your physician's job to offer you the plethora of all the options that are out there. Dr. Wilson, I know that you and I have discussed this before, and that clinical trials are really important to Black women in breast cancer. Having those trials and getting engaged, we have a very low engagement rate, which results in not having targeted treatments for Black women going through breast cancer. But also there are some things that have happened to Black people that are, very traumatic, not just Black patients, but Black people in general. And whether the person's in a blue uniform or a white uniform, that life of leaving your house door in the morning, putting on that emotional armor of watching your surroundings, watching your space in your job environment, your kids having to be aware of who they are, all those things are things that really impact us as Black people. And then when you're in a situation where you don't trust your doctor because of medical mistrust that's happened in the past, and it continues to happen today, it puts you in a place of not asking for certain things or not being offered. And then as a result, we tend to have that 40% higher death rate as Black women. Can you talk a bit about the importance of trials and how do we turn that around? In the sense that my grandmother would always say, how do you use what's meant to harm you for your good? And things were done to harm us in the past, but there are people like yourself and doctors all over the world who are working on trials for Black women. How do we help change a narrative around trials are scary, I can't trust those people, to the fact that we have to be in trials or else we won't have that better outcome?
I think that it is something that we all need to begin to chip away at. I think we can chip away from a clinical standpoint, from a social activist standpoint, from a policy standpoint, all working together for the greatest good of giving more opportunities to women of color. And men diagnosed with breast cancer. I am one of the very few Black female program directors of surgery in the country. We are using our voices in legislation to tell our Congress people and our representatives, what is it that we need for you to do to know that the information and the things that are there for us are actually making it better for us. So in the bigger picture, it is one of those things, clinical trials, we need to own it. We need to inform those around us. We need to inform our patients. We need to inform our clinicians. Cultural humility teaches clinicians that you are not the only one in the room that has information. The information that your patients bring you about who they are is equivalently as important as the information that you bring to them about their disease process. And so clinicians need to approach it in that I'm learning as much from you as you are learning from me. And now we are on an equal playing field.
Yeah, thank you so much. You made a statement, Dr. Wilson, on our last interview a while back. You talked about how people always discuss the negative impacts of breast cancer in Black women, but not the positive parts and the good outcomes and all the things we're doing in this space. And I want to talk to that because, to your point around cultural humility, the narrative in the world is that people of color are not engaging, people of color are not doing, people of color are not following up with their appointments. The fact is that there are multiple barriers that cause those things to happen. However, on the other spectrum, there are people like yourself in there that you're training, other doctors who are Black and brown doctors. There are advocates like Temi. There's people like myself and others who are changing the whole tide of how we view Black people and brown people in the breast cancer space. And I get tired of hearing about all the things that are not going right, that are wrong. I mean, I think it's important to discuss what the problems are. But for one, how are we addressing the solution to the problem? So, there's a quote I read, is everywhere on social media, but whatever you focus on grows. To your point, to Temi's point, she's now an advocate. I'm doing this work. How do we help, I don't want to say force, but I'm going to say the word force, people to stop talking about us like we're just, we're disobedient children? Because what I noticed, I've been looking on the internet, just researching. So somehow the marketing companies are marketing to us in a way where we're buying vast amounts of beauty products, skin products, consumer goods. Why aren't they investing that money and time in marketing to us in a way that helps promote health equity and ending barriers to care, and also celebrating Black excellence in healthcare and advocacy in healthcare?
One of the things I begin to see is that we have to be able to be a part of our own narrative. We have to hold organizations accountable. They thus need to understand that also needs to not only be invested in making more money for them, but also it needs to be an investment in our community and our networks that have been established. There are so many areas of excellence that are out there. I am at Howard University Hospital as well as the College of Medicine. We are the #1 producer of clinicians that are of color in the United States. There is no one else that produces more. But whenever I hear any information that's out there, we're never included. We're never included in success stories. I've been program director for 8 years. And that means I have been involved with over 1,000 students that are Black and brown. I've evaluated everyone that has come through our doors. I've also been involved in educating at least 50 plus surgeons who are Black and brown, who will go out into the community and treat those in our community. We have trained general surgeons to then go on to additional training, and 96% of our residents actually do it right and actually go on to fellowships that are high-level fellowships, really opportunities for our kids to get out there, to be leaders of tomorrow, and to now shape what the next generation is going to be like. We've been able to do that, but no one has ever told our story. There are absolutely opportunities out there like your stories, like your organization, like those organizations that tell the positive side of what we've done. I have been in almost every little program for little Black children, honestly, since I was, my goodness, probably 9 years old. Every opportunity. And why? Because I wanted to come back and invest in my community. I've done that, but no one seems to want to hear about those stories. So many of the kids that we talk about and that we are a part of come back and actually spend time in their community and invest in their community and want to make change. We have advocates like Temi, who just does a remarkable job of sharing her story with this grace and absolute amazingness of, if I were someone who were following in her footsteps with a diagnosis, I would want to do it the way she's doing it.
I have to exhale on that note. That was so powerful. And it's so true that what you said about people not knowing that these role models exist and are accessible to them. When I got diagnosed, I was laying in bed thinking, how can I make a difference? And there was no template for me because the organizations that I found weren't really working with young brown and black women directly. They were not my age. And I wanted to help every woman, at first. But I began to see the disparities with representation. There were not Black-led organizations that were led by a Black woman who was younger. And so I began to build that. And there was not a template. And it was hard. It was a lot of work. People didn't tell you all the secrets and what to do, how to get funding. And I can say honestly, truthfully today, like for 13 years, I worked other jobs while building my organization, self-funding for the most part, and single parenting. And I was like, you know what? I am not going to feel God has given me too much work to do. I got to find the Temis in the world, the Dr. Wilsons in the world. And my daughter's been my biggest advocate because she was 3 when I was diagnosed. And she saw firsthand the struggles I went through, getting through treatment, navigating what to ask for, when to ask for it, survivorship, being triple negative, having that fear of recurrence. And like you, I was curious to know more. So I began to read about science and trials and genetics, and I began to think about, well, why didn't anybody tell me about all these things? I just wouldn't give up because I'm like, there's no template for this to make this work. So I will become the template if that's what God has in mind for me. And then now my goal is to have others, like you, like me, like Temi. Through Tiger Lily, we're really training women of color to become powerful advocates, to go into the world, share their stories, and show people of color what's possible, and show our allies what's possible, because we're not all failing at this. We're not all dying, so fast. We're not all just not listening, not adhering. There are many of us who want to do the work, but we can't do it with our hands tied, which means equitable investment. It means listening. It means support. It means them being in our communities, working with us in the trenches side by side. I never asked people like, who's going to fix the problem? I always said, how can I be a part of the solution? And that's what you're doing. And Temi's doing that as well. And so Temi, you discuss your advocacy and how, you've enjoyed the process. But I see a whole new Temi that I saw on Pajama Glam in June. So talk about, how that journey has empowered you and what you're going to be doing as an advocate to transform people that you live, work, and play with in your community.
So definitely, it's a whole new Temi 2.0. The past 6 months, I'm more brave, more confident, more positive, because it's just something about going through something that makes you like really sit down and think about, wow, like your mortality and just like your life and how you've been living. So I knew I had to make some changes. I know I always heard, tomorrow isn't promised, life is too short, but that was just all cliche to me before this. But now I truly like believe that. So instead of worrying, and I know this is easier said than done, but instead of worrying too much about the future, I just make the most of what I have now. And I try to be positive. I try to be, just the best that I can be every day. And that looks different every day, because some days I'm just like, oh my God. But I try my best to do my best every day. The way I share my story and I share my journey on Instagram, I'm still doing what 23-year-olds do every day, and I'm still living my life, but I'm still bringing awareness. So, I just want to show people that, breast cancer or cancer in general can happen to anyone. You can still keep on living your life. You know what I mean? Yes, you have your bad days, but at the end of the day, I didn't want to be this person who, she was diagnosed with cancer and now she's just like a shadow of herself. With cancer, there's two sides, like I can choose to sit down and think about all the things cancer has taken away from me, but I made the conscious decision to be like, cancer has taken so much away from me. It took my breast, it took so many things like anxiety and stress. But I said, I couldn't control those things, but the things that I can control, I will do my best to control them. So, so it has just empowered me a lot, being able to advocate for myself. I want to be relatable. I want people to be able to just reach out to me and be like, hey, this is how I feel. I'm not sure about this. I'm not sure about that. And I just want to be a listening ear, and also to let people know if anything feels weird or strange, please go to the hospital, ask questions. Even if you think you're being annoying, you're asking the same question 100 different times, it's okay. Ask questions. So that's the biggest thing for me, is just to be relatable and just control what I can and do my best every day, no matter what that looks like.
And that's wonderful, Temi. Asking annoying questions saved my life. I annoyed a doctor that I had for 6 months before I got screened. So it's never wrong to be your best advocate, and it's not annoying either. It's just being persistent and being knowledgeable and being empowered. I'm just so touched by the conversation we're having today. Tiger Lily's whole motto is about beauty, strength, and transformation. And it's about love. And we want anybody who's coming into the space, those who are watching, to know that, breast cancer is a scary thing. We don't choose the sisterhood, but it's a beautiful one to be a part of. Also, you can be transformed by this journey. I came into this space being a bald, scared single mother, not knowing where I would go in life. And it just took that, having trust in God, having faith, and asking questions, being, whether you call it nosy, curious, or persistent, as all those things. And what has evolved now is an organization that's now global, giving patients a voice that are Black and brown and women everywhere to be empowered throughout their breast cancer journey. And also what I love about the work we're doing now is we're really now working to create collaborations with doctors and scientists and researchers to understand the importance of being your patient's, best friend. I mean, Dr. Wilson, the way I grew up, my mother was a nurse. I literally got potty trained walking with her in the hospital. I had 2 bags, a lunch bag for my meal, and then I had a bag for my pull-ups. I was like walking around with her and watching her train lay health workers to become nurses. And so that's something that I learned at a young age, the importance of giving back, the importance of not forgetting where you came from, and the importance of, if you know better, you do better, and you share better. You share better, and you give back constantly. And so I think that the work we're doing here is really powerful. And with Tiger Lily's Angel Advocacy Network, we're getting all these women like Temi, these brave women who are trained to share their stories, use their voices in a way that's more amplified, train other patients to become advocates, train doctors on the importance of hearing their patients, listening to them, and really partnering with them to create solutions. So it's been really amazing having you both on today. Are there things you may want to share before we sign off?
I actually wanted to share 2 things. So the first thing is, I never knew about genetic counseling before I was diagnosed, but the first hospital I went to, they told me about genetic counseling. And after that, I just got really interested in genetic counseling and how everything works. And I just did a ton of research, and I decided that I would like to go back to school to be a genetic counselor. Although I do not have a genetic mutation, I know a lot of people do. And just that field, I'm really excited about that field. So when I'm done with reconstruction and everything, and I take a much needed vacation, I'm going to start my plans to go back to school to become a genetic counselor.
Phenomenal.
Thank you.
The core of everything we're doing is to inspire people to feel the heart of the work, feel the soul of the work. There are many of us, but not enough. And whenever I see a patient come into our doors, and she comes in like you were in June, and she transforms and she becomes this phoenix, then she says, how can I serve? And how can I invest my life and my time to ensure that other patients have different outcomes like that? This is huge for me.
There's only 3% of genetic counselors who happen to be Black. We have one of the most phenomenal young Black genetic counselors at Howard University. Her name is Nicole Thompson. I am sure she would love to be your mentor to help you along the way. I think that One of the things that oftentimes gets lost in what we do is the fact that we are there to support and grow each other. That's not always been the narrative. We are here to serve, we're here to grow. And the fact that if we can share in anything that we have to make you better, then that is the blessing of the day. And that is exactly what we are here to do, to go out and help thousands of women in the future to know what they should about their bodies and about their genetic makeup. And why is it so important for us to know those things? So I'm ecstatic.
Thank you so much.
There's a quote I always share by Miriam Wright Edelman. It says, service is the rent we pay for a living. And that's something I live by. You know, just service is the rent we pay for a living. And I feel like this whole breast cancer journey of mine has been just that, is serving, because that's my rent. And when you hold your hand out to give versus holding that clenched fist like this, there's so much that can happen in your life. And you both embody that quote. You both serve and you give back, and it's so powerful. Temi, just one more thing you can say to inspire the guests before we do sign off. Just one word of advice. And then Dr. Wilson, and then we will thank you for your amazing cards and times today.
If I could say one thing, is to have everyone believe in themselves. So just believe in yourself and trust your gut, I would say. Trust your gut.
One of the things I think is important is to listen to your heart, to make sure that the team that is caring for you is the team for you, that they allow you to let go and be the most important thing, and that's the patient. And so I want to thank you so much for the opportunity to give and to share, because I think that this is the direction that we need to go in our community. I think that this is what's going to make the change. Thank you so much.
Hi everyone, thanks for watching this episode of Breathe TV. As you've seen and heard, it's been really amazing what can happen when your doctor is your best advocate, and as a patient you're empowered to ask the right questions, to have the best treatment and options available, and better outcomes for yourself as a patient. As a breast cancer survivor myself, 14 years now, it's been really powerful hearing these conversations. And for those who are watching who are new to the breast cancer space, come back for more episodes. This is a space to come to breathe, to exhale, and that's a sacred space for you to just be in as you navigate your breast cancer journey. You're never alone. There are people like myself, like Dr. Wilson and Temi, who are here to walk this journey with you, to hold your hand, to love you through this time and beyond. So tune in next time for the next episode. We love you. We're blessed to have you. And see you next time on Breathe TV.